We're the Nurse Family Partnership team. We worked with the Nurse Family Partnership, which is a national nonprofit in 43 states that pairs up registered nurses with first-time low-income mothers to help them improve health and education and financial stability outcomes, not only for the mother, but also for the child that they're expecting. One of the major problems with Nurse Family Partnership is that over time, like any home visiting program, there are fewer and fewer mothers participating in the program, which makes a lot of sense if you consider the fact that they're effectively asking an hour of your time every single week in your home to talk to you about your child for 2.5 years. So attrition is an understandable problem, if unfortunately not a positive problem. But of course, to get the full benefit of the program, you have to stay with the program for the full term of the program. So the longer we can keep people in NFP, the more benefit that they'll get out of the program as it exists. So we can see over time the number of people who are a part of NFP, who drop out of NFP, fewer and fewer people are a part, more and more drop out. And they don't all drop out for the same reason. So there are a number of reasons people might leave that we would consider negative. They were dissatisfied with the program, or their family pressured them not to see the nurse anymore. And there are a few that are positive, right? She went back to school or work, and she just doesn't have time. And of course, NFP cares about more than just participating in the program. NFP hopes to achieve outcomes for these mothers. Outcomes like full-term births and healthy birth weights can be very costly, not only medically, but financially for the mothers and for state governments that pay for mothers' health care often. Also, whether or not mothers breastfeed, whether or not they immunize their child, whether they complete their education if they're part of an education program right now, are all important things to NFP. And as we can see, the majority of NFP's population does meet these goals, but as always, there's room for improvement. So there are a few things so each individual mother may have room to benefit in different areas. Right now, NFP's got a fairly generic model that says all mothers who are low income and at-risk first-time mothers have risk for the same sort of factors. And so we're going to work with all of these mothers on all of the things that might be important to them, all of the outcomes that we just talked about. But what they don't know is which mothers have risk factors for which individual outcomes not coming true. So we've been able to build individual risk profiles for every single mother based on modeling each of the different outcomes. So we can say at intake, when you first join NFP, we ask 125 questions of you about your background, about your status, about your family, and we use that information to build a model of how likely it is for you to drop out of the program early. And if so, when are you going to drop out of the program? How likely is it that you're not going to complete school, or that you're not going to be in school during the program? How likely is it that you're going to lose your job or get a new job, etc.? So, and with this information, of course, NFP nurses can now say, given my target population, this mother has concerns on these things. So the green mother, for instance, has a high risk of dropping out of school and not finishing or graduating, but she's got a very low risk of not breastfeeding. We're pretty confident that she's going to breastfeed, but we're not very confident that she's going to finish school. So the nurse can work with the mother and say, this is an area where I believe that you might need help, and what can I do to support you on these topics? Whereas that same nurse might have another mother whose concerns are completely different. She's definitely going to stay in school. Work isn't an issue for her. She's not going to leave the program, but it's unlikely that she's going to breastfeed her child. And breastfeeding isn't a thing you can come back to after the fact. These are things that you need to know ahead of time to do sort of preventative education and support, because you can't not breastfeed and then go back in time and breastfeed afterward. Similarly, once you leave the program, it's difficult to come back to the program. So knowing ahead of time can be useful. With this information, NFP can develop early interventions for all of these mothers, and the early interventions will allow NFP to keep more people in the program and to achieve better outcomes for all of the people who are in the program, thereby increasing the health and education of thousands of women across the country.